One of the most persistent challenges in nutrition research lies not in complex biochemical pathways or statistical models, but in something deceptively simple: asking people what they ate. Dietary recall, where participants report their food intake, often through food frequency questionnaires, 24-hour recalls, or food diaries, has been a cornerstone of observational nutrition studies for decades. But this method is fraught with error. Inaccuracies in self-reported intake don't just add noise to the data. They can fundamentally distort findings, mislead interpretations, and weaken public trust in dietary guidelines. The core issue is human memory and perception. Most people can't accurately remember what they ate yesterday, let alone over the past week or month. Portion sizes are commonly underestimated or misjudged, and socially undesirable foods, like sweets, processed snacks, or fast food, tend to be underreported, while healthy foods like vegetables and whole grains are often overreported. These tendencies aren't intentional lies, but rather unconscious biases shaped by forgetfulness, social desirability, and confusion about what actually counts as a serving. The result is that the dietary data collected in large-scale studies often lacks precision. If a participant reports drinking 1 soda per week but actually drinks 3, the relationship between sugar-sweetened beverages and disease risk may be significantly underestimated. On a broader scale, when thousands of participants misreport their intake in systematic ways, it becomes harder to draw accurate conclusions about how certain foods influence long-term health outcomes. This problem is especially acute in studies trying to quantify subtle risks, like a 10% increase in diabetes risk from a particular food, where even small errors in recall can overshadow the actual signal. Moreover, dietary patterns are fluid. What someone eats over 1 week may not reflect their habits over the past year. This temporal mismatch further complicates efforts to establish meaningful connections between diet and chronic disease, which typically develop over long periods. The result is that some foods may appear more harmful or harmless than they truly are, depending on how the intake data was collected and interpreted. But technology offers a path forward. In recent years, digital tools have emerged that can radically improve dietary tracking. Smartphone apps, barcode scanners, and photo-based meal logging platforms now allow users to capture what they eat in real time, reducing reliance on memory. Some systems use artificial intelligence to estimate portion sizes and nutrient content based on photos, while others integrate with wearable devices to track eating patterns in the context of activity levels, sleep, and other lifestyle factors. These tools can provide more accurate, time-stamped, and detailed dietary data, improving both the quality of research and the feedback given to individuals. On a more advanced frontier, researchers are experimenting with biomarkers, objective indicators like blood, urine, or breath metabolites that can reflect recent dietary intake. For example, certain compounds in urine can indicate consumption of red meat, coffee, citrus fruits, or alcohol. While not yet capable of fully replacing self-reporting, these biological measures can validate or correct self-reported data, creating a more reliable picture of actual intake. Still, no method is perfect. Technology-assisted tracking tools require user engagement and may introduce their own biases, such as more consistent logging among health-conscious individuals. Biomarkers can be expensive and are often limited to specific nutrients or food groups. But even so, these innovations represent a clear improvement over traditional recall methods and offer a pathway toward more accurate, reproducible nutrition science. Fixing dietary recall doesn't mean achieving perfect data overnight. It means embracing tools that reduce reliance on flawed memory and increase objectivity wherever possible. It also means designing studies that account for these limitations up front, acknowledging that precision matters when small effects on large populations drive global health policy. In the end, improving how we measure what people eat is not just a technical concern. It's foundational to understanding how food shapes our lives. Better data means better science, and better science means smarter policies, clearer guidelines, and more effective public health interventions. In a field where trust and clarity are often in short supply, these improvements could reshape not just research, but outcomes.